It's my pleasure to introduce the first speaker, Dr. Michaud. Dr. Michaud works in ophthalmology near Geneva for many years, and his presentation is titled A Measurement of the Retention Time of Two Different Carbomer-Based Ophthalmic Gels with Ultra-High-Resolution OCT in Anesthetized Dogs, a Pilot Study. Welcome.
We're looking for the laser.
Oh, laser pointer. Ruh-roh.
I can begin without, so you can look for it. Yeah, doesn't matter. Okay. Thanks. So good morning. Thank you for the brave people who got up early this morning to access to this conference, this meeting. I would like to thank the ECVO scientific committee for accepting my presentation today, and also for the very nice gala dinner yesterday evening. We had a lot of fun. Today, I will be presenting our pilot study focused on 11 dogs evaluating and comparing retention time of two different ophthalmic gels over the cornea using the ultra-high OCT in high resolution in anesthetized dogs. I would like to disclose that Dome Pharma, a French lab, provided some support for study design and statistical analysis. However, I received no financial compensation, and the company had no influence over data collection, analysis, or interpretation. So why study retention time of ocular gel? So first, corneal dehydration and exposure keratitis during anesthesia are really well-known risks. Carbomer gels are widely used, and they can provide, and they do provide, viscous and sustained hydration. Hyaluronic acid, with its mucoadhesive and viscoelastic properties, could offer improved retention. Thanks. To our knowledge, no veterinary studies have ever used SD OCT to evaluate this kinetically. So today's study objective. So we aim to compare the corneal retention time of Ocry gel and Lube Pro. Ocry gel is a 0.2% carbomer-based product, and Lube Pro is a 0.2 carbomer plus combined with 0.3% hyaluronic acid. So the goal is to evaluate whether hyaluronic acid prolongs the corneal presence with time. So we measured the central tear film thickness, the CTFT, over time with SD OCT to track the persistence of each gel on the corneal surface. We also wanted to evaluate whether the high-resolution OCT is a viable and non-invasive method to assess the tear film kinetics in clinical veterinary settings. So we included 11 client-owned healthy dogs admitted in our clinic for general anesthesia with a standardized protocol with medetomidine, butorphanol, ketamine, and isoflurane. Each dog received 200 microliters of each gel, Ocry gel in one eye and Lube Pro in the other eye. They were assigned randomly, and CTFT was measured at regular time points from T0 to T60. So the mean age was approximately 6.9 years with a relatively wide range of age, which reflects the real-world diversity of patients undergoing some elective surgery in our clinics. The sex distribution was pretty balanced with 6 males and 5 females. Regarding the breeds, we got 9 different breeds, including Australian Shepherd, Huskies, Japanese Spitz, Bichon, French Bulldogs, Pugs, and mixed breeds. Based on the skull morphology, 4 dogs were classified as brachycephalic and 7 dogs classified as non-brachycephalic. The most common surgical indication was mass removal that was observed in 7 dogs. And we got 3 dogs that came to be neutered and 1 dog had a wound suturing. Importantly, none of the procedure involved any ocular or periocular areas, ensuring that the ocular surface was unaffected and suitable for analysis. So we used a very fancy device, so the full range spectral domain OCT, which is a Solix by Visionanimale company. The measurements were performed at the center of the pupillary area, from the corneal epithelium to the gel air interface. The minimum measurable CTFT that the machine could allow was 5 micrometers, and we tried to standardize the installation and spreading method of the gels over the cornea throughout the study. So there is a video here, and you can see the installation phase of the protocol. So first step, we just apply the 200 microliters in the upper conjunctival fornix, and we manually perform 3 eye blinks to ensure the even distribution of the gel over the cornea. A lid speculum, once then placed, just to open the eyelids. And secondary, we just attach an hemostatic forceps just to stabilize the globe position. So this setup allowed us to acquire consistent center OCT images from the corneal surface. So we then position the OCT device and acquire the image once the eye is properly aligned. So the measurement is performed manually from the outermost edge of the gel interface to the corneal epithelium. So all OCT images were reviewed and measured manually by the same operator, me. And just the goal was to ensure the measurement consistency and reproducibility. So on this slide, you can see the, oops. So on this slide, you can see it introduces the main findings of our study using a representative case. So we selected a single dog and displays a full series of OCT scans during the time. So you got 11 scans per eye. It's from the baseline, so T0. Doesn't work. Okay. So they're from T0 to T60. So the right eye, received Ilupro, while the left eye received Ocry gel. As you can see, so then we focus on the three last time points, final time points between 45 and 60 minutes. So as you can see, the hyper-reflective layer at the top of the cornea for the left eye. So the eye that was treated with Ocry gel, corresponding to the gel interface, disappears between the 45 and the 50 minutes. So in contrast, Ilupro remains clearly visible on the corneal surface even at 60 minutes. So these examples illustrate the longer persistence of Ilupro, which was confirmed across the study population in the quantitative analysis I'm going to show you. So this curve represents the mean CTFT, over time. So you can see that the CTFT decreased progressively for both gels. Ocry gel is represented in the blue color, and Ilupro is represented as the orange color. The background color represents the standard deviation for each product we use. So the mean CTFT decreased progressively for both gels. However, Ilupro maintained a significantly and very high CTFT at all time points and higher than Ocry gel. At the 60 minutes time point, we observed a clear difference in gel retention between the two products. For Ilupro, the mean corneal tear film thickness at 60 minutes was 37.7 microns, with a standard deviation of 30 microns. In contrast, for Ocry gel, the mean thickness was only 2.3 microns, with a standard deviation of 7.5 microns. So this highlights a markedly longer persistence of Ilupro on the ocular surface compared to Ocry gel. So those findings support the potential clinical benefit of Ilupro in situations requiring some extended ocular surface protection. Here is the decay curve. So the decay curve, this graph shows the clearance dynamics of the two gels over time based on the number of dogs with a measurable corneal tear film thickness. On the y-axis, we have the number of dogs with detectable gel on the ocular surface. The x-axis shows time points from baseline to 60 minutes. Each drop in the curve corresponds to the loss of measurable signal in one or more dogs. As you can see, the Ocry gel curve drops progressively, with only one dog still retaining the gel at 60 minutes. In contrast, Ilupro shows a significantly greater persistence, with 8 dogs still showing visible gel at T60. So this visual representation reinforces the quantitative data, meaning that Ilupro remains on the corneal surface longer with a greater consistency over and across individuals. These results suggest a more stable and prolonged effect of Ilupro in vivo, which may translate into clinical benefit in patients requiring some sustained lubrication over time. So we conducted a statistical analysis with the repeated measures ANOVA to evaluate the effect of the treatment over time on the corneal tear film thickness. This analysis showed a highly significant overall effect with a p-value below 0.001. To explore this further, we performed a post-hoc pairwise comparison at each time point using the bone-pharaonic correction. Those results show that CTFT was significantly higher with iLupro and Ocry gel at every time point from T10 to T60. There was absolutely no significant difference at baseline, right after gel installation. This may be explained by variation due to the blinking. We also tested whether demographic factors such as sex, age, or skull morphology had any influence on the gel persistence, and none of these variables had any statistically significant effect, with p-values consistently above 0.1. So this suggests that the observed differences between the two products are robust and consistent, regardless of individual anatomical variation. Our findings are consistent with the recent study by Bedos, who used the fluorophotometry in dogs to compare the retention time of various gel formulations. They also observed that gel-based lubricants have a prolonged ocular surface residence time, which supports our OCT-based results. Compared to fluorophotometry, OCT is less invasive and provides some direct anatomical imaging of the corneal surface. It allows precise and topographically accurate measurements of the tear film thickness without altering the formulation relying on tear sampling. Additionally, our study extends the work of Gagliano in humans, which assesses the ocular retention of hyaluronic acid-based lubricants in humans using OCT. By applying the same methodology in our study in dogs, we demonstrate that the enhanced persistence observed in humans can also be measured and confirmed in veterinary settings. The prolonged CTFT we observed with iLupro, which combines hyaluronic acid and carbomer, is in line with the non-viscoelastic properties and mucoadhesive properties of hyaluronic acid. So this suggests a synergistic effect of the two polymers, resulting in more stable tear film retention. Of course, our study has a few important limitations. As it's a pilot study, we only have a quite small sample size that we have to increase now. Then the sample size was pretty small with only 11 dogs, which reduces the statistical power. Second, all procedures were performed under general anesthesia, so which suppresses the blinking and slows down the tear clearance. Therefore, retention time in our study cannot be extrapolated to awake animals and may be significantly shorter. Finally, OCT underestimates certainly the film thickness in the final stages, as the signal reflectivity of OCT drops below 5 microns, the lower detection limit of the system. In conclusion, so our data shows that iLupro offers a prolonged precorneal presence. OCT proved to be a valuable, non-invasive monitoring method, and in anesthesia or a dry eye, hyaluronic acid-based gels could reduce frequency of instillation. And further studies in non-anesthetized subjects will be necessary just to assess how these products behave in the normal ocular surface physiology. So I'd like to thank Dom Pharma for the kind support for the study, as well as my intern, Dr. Chien, and the nurses at Animal Clinic for their invaluable assistance and fun. Here is some bibliography, and I thank you for your attention with a wonderful view of Mont Blanc from the ski slopes just behind the clinic. And I would be happy to answer any of your questions if you have. Thanks.
I have a question for you. So I noticed that your OCT was done in dorsal recumbency. Is that because of the OCT, or did you have variance in the positioning of the animal which might have affected gravity, sort of flow of the lubricant over the surface of the eye?
That's a very good question. I did not indicate that, but as we perform those surgeries over 11 dogs, we got dorsal recumbency in 9 dogs and ventral recumbency in 2 dogs. And we just compare that statistically, and there was no statistic difference between the both positions. But it's a really, really good question we asked about this. Thanks.
I also have a question. You're planning to do any similar research with this technique in cats?
We are planning to do that, but not yet.
Okay, thank you so much.
Thanks.
Appreciate it.